One of the reasons we are seeing more cases in the official tally is that testing has now been expanded, but still, people with symptoms and underlying health conditions are telling us they cannot get anyone to swab them for testing. Brendan Keefe investigates.
Well, they diagnosed it as pneumonia.
Add Melissa Spielholtz to the list of at-risk patients who can't get a COVID-19 test.
You would qualify for a test under the current protocol, right?
I've had symptoms that are very textbook to what they're saying the symptoms are, and they're not testing me. So how many of me are there out there?
These are some of the signs outside doctors' offices warning the sick not to enter. Some send patients to state hotlines.
You can't get a human on the phone. It basically directs you back to your physician, and then your physician directs you to the hotline. I mean, it was an absolute circle.
The reproductive rate of the COVID-19 virus with minimal interventions is expected to be around 2. That means the average infected person can be expected to infect 2 more people. But that progression isn't 2, 4, 6, 8, 10. The number is compounded. That means one person infects 2 people, 2 people infect 4 people, 4 people infect 8 people, 8 people infect 16 people, 16 people infect 32 people, 32 people infect 64 people, 64 people infect 128 people. That means if one infected person who doesn't need medical attention stays out of the hospital, out of the doctor's office, stays at home, they can keep themselves from infecting hundreds of people.
Millions of people are heeding the call, staying inside from coast to coast, with some cities and entire states ordering their citizens to shelter in place indefinitely. The guidelines for testing are inconsistent. It's up to your doctor, but there's no requirement that any office or facility has to offer coronavirus testing.
The fact that one of our biggest hospital groups is only testing employees speaks volumes. They don't want the healthcare workers to get sick, which, while it's understandable, it's not doing the public any good.
Melissa ultimately got an at-home swab kit, which the lab picked up in person. Self-tests are not yet FDA approved, but some at-risk patients with symptoms say they're left with no other choice. In Atlanta, I'm Brendan Keefe.
Viewers are telling us some hospitals are still using foreign travel as a prerequisite for testing, months after the first cases were reported in the United States.